You're giving your dog some ear scratches, maybe admiring their handsome profile, and then your eyes land on their nose. It looks, well, different.
Yeah.
A little faded, perhaps, maybe even a bit rougher than usual. That little pang of worry. That's exactly what we're diving into today. We're going to unpack Canine Discoid Lupus Erythematosus, or DLE.
Okay, let's really get into this. Canine DLE, as our sources define it, is seen as a, let's say, relatively mild form of the bigger picture, systemic lupus erythematosus.
Right, the systemic one.
But the crucial thing, I think, to understand is that DLE in dogs is primarily an immune-mediated skin disease.
Ah, okay. Skin focus.
Yes. We're mainly looking at how it affects the nasal planum, that's the very top, leathery part of the nose, along with the face, and sometimes the ears.
Gotcha.
Now, the name lupus can sound, well, a bit scary, right? Because the human version, which can hit many organs.
Definitely.
But with canine DLE, our focus is pretty much entirely on the skin.
Right. And understanding this, spotting those, initial subtle changes can be so important.
Absolutely crucial.
It can really make a difference in your dog's comfort and help prevent more significant changes to their appearance down the line. We're going to try and break down what you need to know, skipping the really complex medical jargon.
Keep it clear.
Exactly. Now, if you happen to have a collie, a German Shepherd, a Siberian Husky, Shetland Sheepdog, Alaskan Malamute, or a Chow Chow, or, any beloved mix of these breeds, this is definitely something you'll want to pay close attention to. These breeds seem to be more prone to DLE.
That's what the data suggests, yeah.
And just a quick note for our cat people listening, DLE is quite rare in cats.
Very uncommon, yes.
Interestingly, it seems it can pop up in dogs of any age, too, no specific age group.
No, there doesn't seem to be a strong age predilection. It can happen young or old.
Okay.
So our aim in this deep dive is really to give you a clear understanding of the signs to watch for.
What to look out for.
Exactly. And what the likely factors are that contribute to it, how your vet will figure out if it is DLE.
The diagnosis part.
Right, the diagnosis, and of course the range of treatment options available. We want to equip you with the knowledge to feel, empowered and informed about your dog's health.
Okay, perfect. So let's start with what you as an owner might first observe. What are those very first signs?
Well, the earliest signs of DLE often involve a change in the color, the pigment of your dog's nose, and maybe the lips too.
So like fading or patches losing color.
Exactly. You might see a fading or a distinct loss of that normal black or dark pigment. That's often the very first thing people notice.
And then what happens? Does it stay like that?
Not usually, no. What's kind of interesting, or concerning really, is how that initial depigmentation can progress. It's not typically just a cosmetic color change.
Okay.
Over time, those areas can develop into erosions, like little shallow scrapes,
Right.
and even ulcerations, which are, deeper breaks in the skin surface.
Ouch, that sounds uncomfortable.
It certainly can be. And another really key visual cue, especially on the nose, is the disappearance of that normal cobblestone texture.
Yeah, that slightly bumpy feel.
Precisely. A healthy dog's nose has that texture. With DLE, that can start to flatten out, become smooth, and eventually look quite damaged.
And it sounds like it can go beyond just the surface-changing texture and color. Our sources mention actual tissue loss and scarring can occur.
Yes, that's unfortunately true in chronic or severe cases. These long-standing lesions can become quite delicate, quite fragile.
Meaning they might bleed easily.
They might, yes. They can bleed more easily if bumped or irritated. Thankfully, the risk of really serious bleeding from larger blood vessels is uncommon, but oozing can happen.
Okay. Now, while the nose is often the first thing we think of, you mentioned it isn't just the nose and lips, right?
That's right. Well, the nose and lips are definitely the most common spot.
The hot spots, so to speak.
Yeah, exactly. But we can also see changes on the pinnae, that's the ear flaps,
Okay.
and in the periocular region, which is just the skin directly around the eyes.
Around the eyes, okay. Any other areas?
Less frequently, yes. DLE can sometimes affect the pads of the feet and even the genital area.
Wow, okay.
So while a change in nose color is a big flag, it's definitely wise to be aware of any similar changes, like pigment loss or erosions in these other locations as well.
Good to know. Okay, so what actually kicks off this whole process? What are the potential causes, the risk factors for DLE? Do we know?
That's a really important question. And, well, the honest answer is that the precise mechanism, the exact way DLE develops, isn't completely understood.
One of those mysteries still.
It is, to some extent. It's one of those conditions where we can clearly see the effects, but that initial trigger,
Mm.
It's still being actively researched.
But there must be some clues, right?
Oh, definitely. There's strong evidence pointing towards actinic radiation, which is basically ultraviolet light, UV light playing a significant role.
So sunlight, it's like a really severe reaction to sunlight on the skin.
In a way, yes, that seems to be a major factor. The current thinking is that UV light might cause damage to the DNA within the skin cells, specifically the keratinocytes, the main cells of the epidermis. This damage could then sort of alter these cells in a way that the body starts to see them as foreign.
And triggers the immune system.
Exactly. It triggers an autoimmune response where the immune system mistakenly attacks its own skin tissues.
That makes sense.
And this idea helps explain why we often see DLE flare-ups that seem seasonal or geographically influenced.
Meaning worse in summer, maybe? Or sunny places?
Precisely. They tend to be more pronounced during times of increased sun exposure, like the summer months, or in regions with higher levels of UV radiation year-round. It sort of ties it together, doesn't it?
It really does. So if you notice your dog's nose looking significantly worse during the sunnier parts of the year, that could be a pretty strong indicator.
It's definitely a pattern worth noting and mentioning to your vet.
Okay. Now, if you observe these kinds of changes, it's natural to be concerned, but getting an accurate diagnosis is crucial, as you said. What else could be going on? What does the vet need to rule out?
Absolutely. Diagnosing DLE isn't always straightforward because several other conditions can look quite similar on the surface.
Right.
This is where that concept of differential diagnosis comes in. Your vet needs to systematically consider and rule out other possibilities.
Like what, for instance?
Well, other immune-mediated skin diseases are high on the list. Things like pemphigus foliaceus, or PF,
Right.
and pemphigus erythematosus, PE.
Okay.
They'll also need to consider systemic lupus erythematosus, SLE. Remember, that's the one that affects multiple body systems.
The systemic one we mentioned.
Exactly.
Yeah.
But SLE usually has other signs too, whereas DLE is primarily skin-focused. Other things to consider are adverse reactions to certain drugs,
Drug reactions.
dermatomyositis, which is another immune condition affecting skin and muscles, nasal dermatophytosis, that's a fungal infection of the nose area,
Fungal, okay.
mucocutaneous pyoderma, which is a specific type of bacterial skin infection affecting areas where skin meets mucous membranes like the lips and nose,
Yeah.
and even hypersensitivity reactions, say, to insect bites.
Wow, that's quite a list of possibilities already, and I imagine that's not even everything.
You're right, it's not exhaustive.
Yeah.
There are some other less common conditions your vet will keep in the back of their mind too.
Such as?
Things like contact allergies, maybe to a food bowl material or something. A condition called zinc-responsive dermatosis, where a lack of zinc affects the skin. Simple physical trauma.
Trauma, okay.
Superficial necrolytic dermatitis, which is linked to metabolic issues. And importantly, certain types of skin cancer need to be ruled out, like epitheliotropic cutaneous T-cell lymphoma or squamous cell carcinoma.
Cancers too. Okay, that really highlights why you need a vet involved. You can't just guess.
Absolutely not.
Yeah.
Self-diagnosing based on appearance alone is just not reliable here. Professional assessment is key.
Okay, so how does the vet actually go about confirming it is DLE? What tests and procedures are we talking about?
Well, the initial steps often involve standard blood tests, a complete blood count, or CBC, a biochemistry profile, and urinalysis.
The usual blood workup.
Exactly.
Yeah.
And interestingly, in most dogs with DLE, these routine tests actually come back pretty normal.
Really?
Yeah, unless there's some other unrelated health issue going on at the same time. This normalcy can actually be a helpful clue in itself
How so?
because it helps distinguish DLE from more systemic conditions like SLE, where you would often expect to see abnormalities in those blood parameters, like low white blood cells or protein in the urine, for example.
Ah, I see. So normal blood work might lean more towards DLE being the primary issue.
It's a significant piece of the puzzle, yes.
Mm-hmm.
Our sources also mention specific immune-related tests, like the ANA test, that's the anti-nuclear antibody test,
Okay.
the ELITE preparation, and Coombs tests. Now, these are tests often used to help diagnose SLE.
And in DLE.
In DLE, these tests are typically normal or negative, which again helps point away from SLE and more towards DLE.
Makes sense. So blood tests help rule things out, but what gives the definitive answer?
The most definitive way to diagnose DLE is through a skin biopsy followed by histopathological examination.
Okay, so they actually need to take a small sample of the affected skin tissue.
Correct. A tiny piece, usually under local anesthetic or light sedation.
And then examine it under a microscope. What exactly are they looking for at that cellular level?
Exactly. Under the microscope, the pathologist is looking for specific patterns of inflammation within the skin layers.
What kind of patterns?
In DLE, it often shows up as what's technically called an interface lichenoid dermatitis. You can think of this as a specific way the immune cells are arranged and interacting right at the junction between the epidermis, the top skin layer, and the dermis below it.
Okay, like inflammation at that border.
Precisely. They'll also look for signs of basal cell damage or death that's called apoptosis in the bottom layer of the epidermis. Maybe some thinning of the epidermis called atrophy, and something called pigmentary incontinence.
Pigmentary incontinence.
Yeah, it basically means the pigment cells are damaged and the melanin pigment granules kind of spill out into the deeper skin layer, the dermis.
Okay, so those microscopic clues add up.
They do. Now, the sources do note something important. Sometimes the microscopic findings in DLE can look quite similar to those seen in mucocutaneous pyoderma, that bacterial infection we mentioned.
Ah, so the biopsy might not be 100% clear-cut immediately.
It can sometimes be tricky to differentiate just on biopsy alone, especially if there's secondary infection. This is why your vet might sometimes recommend a trial course of antibiotics before doing the biopsy.
Why is that?
Well, if the lesions improve significantly just with antibiotics, it strongly suggests a bacterial infection was the main problem, or at least a major component.
Got it. Clears the picture a bit.
Exactly. Also, regarding the biopsy itself, timing and location matter. It's generally best to take samples from early lesions, maybe areas with just pigment loss or mild erosion or just slight crusting.
Not the really bad spots.
Preferably not, if possible. Severely crusted or deeply ulcerated lesions often have a lot of secondary changes in inflammation that can obscure the primary DLE features, making interpretation harder for the pathologist.
Okay, good tip. Any other tests?
Well, further specialized immunologic tests, like immunofluorescence, can sometimes be done on the biopsy sample, but they're usually not necessary just for diagnosing DLE itself. The standard histopathology is typically enough.
Right, so the biopsy is really the key to getting that clear answer. Once DLE is diagnosed, what are the main approaches to treatment and managing it long-term?
Okay, treatment. First off, it's really important to emphasize again that while DLE can definitely affect your dog's appearance and cause discomfort if it's not managed.
It's usually not life-threatening.
Exactly. It's generally not a life-threatening condition. Now, the first, and you could argue most critical, aspect of managing DLE is significantly reducing or, ideally, completely avoiding direct exposure to sunlight.
Because of that UV trigger we talked about.
Precisely. Think of UV radiation as fuel for the fire in this condition. So limiting sun exposure, especially during peak UV hours, is step one.
And using sunscreen.
Yes. Alongside limiting exposure, the regular application of a good quality waterproof sunscreen to the affected areas, especially the nose, maybe the ear tips if they're involved, is highly recommended.
Should it be a specific dog sunscreen?
That's the ideal, yes. While some human baby sunscreens might be okay if they don't contain zinc oxide or PABA, it's always safest to use a product specifically formulated and tested for dogs to avoid any potentially irritating or toxic ingredients if licked off. Your vet can recommend suitable ones.
Good point. Okay, so sun avoidance and sunscreen. What about medications?
Right, medications. There are both topical, applied directly to the skin, and systemic given by mouth options.
Let's start with topicals.
Okay. For topical treatment, potent fluorinated glucocorticosteroids, which are strong anti-inflammatory steroid creams or ointments.
Like cortisone creams, but stronger.
Exactly, often much stronger. Something like a 0.1% fluocinone cream might be used initially to really calm down that inflammation quickly.
How often would you use that?
A typical starting approach might be applying it once every 24 hours, so daily, for maybe the first 2 weeks. Then, as things improve, you'd gradually reduce the frequency maybe to once every 48 hours, then every 72 hours.
Tapering down.
Yes, always aiming for the lowest effective frequency. And once the condition is well under control, in remission, your vet might try switching to a less potent topical steroid, like a 0.5% or 2.5% hydrocortisone, for long-term maintenance, if possible.
Okay. Are there non-steroid topicals?
Yes, definitely. Another very effective topical option is tacrolimus ointment. It's a different type of drug, an immunomodulator.
How does that work?
It works by inhibiting something called calcineurin, which is a key protein involved in activating T cells. Those are important immune cells driving the attack on the skin in DLE, so it calms the immune response locally.
And how is that used?
It's often started with applications once or twice a day, and then, similar to the steroids, tapered down to maybe once daily or every other day or even less as the lesions improve. It's a good alternative, especially for long-term use, as it avoids some potential side effects of chronic steroid use.
Right. And what if these topical treatments just aren't enough, or the case is really severe?
Yeah, in those situations, or if the affected areas are very widespread, systemic medications pills might be necessary.
What are the options there?
One common first-line systemic approach involves a combination of an antibiotic called tetracycline and niacinamide, which is a form of vitamin B3.
An antibiotic and a vitamin. How does that work for an immune condition?
It's interesting, isn't it? They aren't used for their primary antibiotic or vitamin effects here. Both tetracycline and niacinamide seem to have immunomodulatory and anti-inflammatory properties when used together at specific doses.
Ah, okay. What kind of doses?
The dosages are usually based on the dog's weight. For smaller dogs, say under 10 kilos, it might be 250 milligrams of each, given 3 times a day. For larger dogs, 500 milligrams of each, 3 times a day.
Okay. Any alternatives in that family?
Yes, alternatives within that tetracycline group include doxycycline, which is often given just once or twice a day, and minocycline, usually twice a day. These might be options if the 3 times a day schedule is difficult or if tetracycline isn't tolerated well.
Got it. What if that combination doesn't work or isn't suitable?
For more severe cases, or those that don't respond well to the tetracycline-niacinamide combo, a systemic corticosteroid like prednisone might be considered.
Oral steroids.
Right. This would typically be started at a higher anti-inflammatory dose to get things under control quickly, and then, very importantly, gradually tapered down over weeks or months to find the lowest effective dose that keeps the signs at bay, often aiming for alternate day therapy if possible.
To minimize side effects, presumably.
Exactly. Long-term steroid use has potential side effects we want to minimize.
Yeah.
In some really tough cases, prednisone might even be used in combination with another immunosuppressant drug called azathioprine.
Adding another layer of immune suppression.
Yes, but that requires even closer monitoring due to potential side effects of azathioprine itself, particularly on the bone marrow. Another alternative systemic immunosuppressant that vets might use is cyclosporine.
Cyclosporine, okay. How does that fit in?
It's another potent immunomodulator working differently from steroids or azathioprine, primarily targeting T cells. It can be quite effective for DLE, but also requires monitoring and can be expensive.
Lots of options, but they sound like they need careful management.
Very much so.
Yeah.
And the sources make another really important point regarding those potential bacterial infections we discussed earlier, like mucocutaneous pyoderma.
Right, the ones that can look similar.
Yes. If your vet suspects that a bacterial infection might be contributing to the lesions, they will likely want to treat that with a course of systemic antibiotics, maybe for 3 or 4 weeks, before starting any of these systemic immunosuppressants like prednisone or cyclosporine.
Why that order?
It helps clarify the situation. You want to clear up any infection first, see what improves just with antibiotics so you get a clearer picture of how much is truly the underlying DLE versus infection. You also generally want to avoid suppressing the immune system if there's an active bacterial infection present.
That makes perfect sense. Treat the infection first.
Exactly. And just quickly, there are also some supportive therapies sometimes mentioned. Oral supplementation with vitamin E is thought to possibly help reduce inflammation and offer some antioxidant protection to the skin.
Vitamin E, interesting.
And sometimes hydroxychloroquine, which is an antimalarial drug commonly used for lupus in humans, might be considered for canine DLE as well, though it's maybe less common than the other options.
Okay. It certainly sounds like there's a good range of treatment options available, which is reassuring. What about the long-term outlook and what kind of follow-up care is typically needed?
Yeah, ongoing monitoring is definitely key with DLE. Your vet will likely want to schedule recheck appointments, probably around 2 to 4 weeks after starting any new treatment, just to see how well your dog is responding.
Assess progress.
Exactly. Then, the frequency of follow-ups depends a bit on the treatment. If your dog is doing well and managed just with topical therapy, maybe routine blood work like that CBC and biochemistry profile might just be done annually as part of their regular wellness check.
Okay.
However, if your dog is on systemic medications, especially immunosuppressants,
Like prednisone or cyclosporine?
right, then blood tests will likely be recommended more frequently. Perhaps every 3 to 6 months, sometimes more often initially, to monitor for any potential side effects on the liver, kidneys, blood cells, and just to check their overall health.
And you mentioned azathioprine needs even closer watching.
Yes, if azathioprine is used, the monitoring needs to be more intensive, especially at the start, We're talking blood counts, including platelet counts, maybe every 2 weeks for the first month or so, then spacing out to every 3 to 6 months if things are stable because of its potential effects on bone marrow.
Right. Careful monitoring is crucial then.
Absolutely. And of course, as we stressed, minimizing exposure to ultraviolet light remains a fundamental part of management for the rest of the dog's life. It helps prevent flare-ups.
That sun avoidance is non-negotiable, really.
Pretty much, yeah. It's a cornerstone of managing DLE long-term.
Are there any potential complications that owners should be aware of down the line, even with treatment?
Yes, unfortunately, even with good management, some potential complications can arise. Scarring in the affected areas is possible, especially if the inflammation was severe or chronic before treatment started.
Permanent changes.
Possibly, yes. Secondary bacterial skin infections, that pyoderma, again, can sometimes occur as flare-ups or if the skin barrier is compromised.
So watching for infection signs is important too.
Definitely. Occasional minor bleeding from fragile lesions might still happen. And, if the condition isn't consistently well managed, there can be permanent disfigurement or changes to the appearance of the nose, face, or ears.
Okay. But what's the general prognosis? If you get the diagnosis and start treatment, what can people expect?
Well, the natural course of DLE, if it's just left untreated, tends to be progressive. It usually gets worse over time.
But it's not usually fatal.
Correct. It's important to reiterate that it's generally not considered a life-threatening disease in itself. The really good news is that with consistent and appropriate treatment, the vast majority of dogs with DLE can achieve a good level of remission.
Meaning the signs are well controlled.
Exactly. Symptoms are minimized or absent, and the dog is comfortable. Now, for those dogs that do require long-term, more aggressive immunosuppressive therapy, maybe combinations of drugs.
The tougher cases.
Right. Their overall prognosis might be considered a bit more guarded just because of the nature of the therapy and the potential for side effects. But even in these more challenging cases, periods of remission are still very achievable with diligent management and close veterinary supervision.
So overall, a fairly positive outlook with proper care.
Yes, I think for most cases, the outlook is quite good for maintaining quality of life.
Okay, so sort of bring it all together then. Canine Discoid Lupus Erythematosus, DLE, it's a manageable immune-mediated skin condition in dogs. It primarily affects the nose, face, and sometimes ears.
That's the main picture, yes.
Recognizing those early subtle signs like that change in nose color or texture and getting your dog to the vet for a proper diagnosis, ruling other things out, maybe getting that biopsy is really the first crucial step.
Couldn't agree more. Early intervention helps.
And while UV light, sunlight, seems to play a really significant role in triggering or worsening it,
A major factor.
there are a variety of effective treatment options available, from sun avoidance and sunscreens to topical creams and systemic medications. And for many dogs, the long-term outlook is actually pretty positive.
Precisely. Consistently avoiding that excessive sun exposure and carefully following your veterinarian's recommendations regarding the specific medications, the tapering schedules, the regular checkups. That's really the key to keeping DLE under control and ensuring a good quality of life for your canine companion.
Absolutely. And maybe on that thought, here's something to ponder for our listeners. Given how environmental factors, like something as common as UV light, can trigger this kind of specific immune response in our dogs, what other seemingly ordinary external influences might be subtly impacting our pet's health in ways we are only just beginning to understand?
That's a fascinating question. Food for thought.
Definitely something to think about until our next deep dive.